Hello, and welcome to the Fertility Center of Las Vegas, to your donor screening visit. I am Dr. Carrie Bedient. Today, we are going to take the next 15 minutes or so to walk through how this process works. And you're going to have a doc come in afterwards who will help get you through some of the physical parts of this visit and to answer any specific questions you have. We really want to make sure that you know what you're doing, you understand, and you're very comfortable with all of this. So please, if you have any questions, don't hesitate to ask your doc, the staff. We all want to make sure that you're comfortable and happy as you're going through this process. So today's visit. Today's visit's pretty simple. We're going to go through your medical history. We are going to do a physical exam. This includes listening to heart and lungs, as well as a breast exam and a pelvic exam. And then we're going to do a vaginal ultrasound. The purpose of the vaginal ultrasound is to take a look at your ovaries and get an approximate egg count, so we kind of have an idea of what we might get during an egg retrieval. Now, once you're through this visit, we are waiting for medical clearance to occur. And medical clearance is getting back all of those labs that have been done to make sure there's nothing medical that we need to pay attention to, like diabetes or anemia or an infection, something like that. We get back the genetic testing. So you'll talk to a genetic counselor if you haven't already. We will have you get some blood work for genetic testing. And then, of course, you're also going to go through the psychoeducational counseling. So this is talking with a psychologist about how this process works, any impacts it could have on you, go through some of your history. And once we have all of these different components together and everything looks good, you get medical clearance. This takes about a month or so. Most people are going to need genetic testing, and that blood work takes about a month to come back. So that's the timeline for medical clearance as you're going through this. Next is legal clearance. Now, for a lot of people, this is pretty straightforward. There's a lot of variety here. For some people, they're just going to sign the paperwork and move right on. For others, they will have a brief chat with a lawyer so they understand what they're signing and move on. And there will be others who are working with an agency or are known donors, and they have their own lawyer to work with through all of this. And so usually by this point, you know which of those categories you fall into. But if you don't, please talk to our donor coordinators and they can help you understand that more. Next, let's talk about the medications and the egg retrieval. Once you are both medically and legally cleared, we are going to have you let us know when you get your period. On the first day of your period, you let us know, because on the second, usually the second, maybe third day, we have you come in for baseline labs and ultrasounds. And this is checking to make sure that your hormone levels are nice and low, and also that there's not a cyst on your ovaries that can get in the way and cause any drama. Once we know that that looks good and it's nice and clear, we are going to have you start taking your medications. And these are medications that you're going to take by injection. So injections you give yourself every day for about 2 weeks. During that time, you are going to know all of our staff. You'll be in and out a fair amount, and you will come in early, get your labs and ultrasounds, and then you're going to leave and go about your day. We get those results back early afternoon and figure out what's happening next, whether it's changing your dose, seeing you back in 2 days, ready for trigger and retrieval. And then the coordinators will reach out to you and let you know what's next. Once you know what's next, and we get to the point of the trigger, which is where the eggs are nice and big, we then have you take that trigger shot at a very specific time. This trigger shot is going to determine what time we're doing your egg retrieval. And so most of your injections you take, 7 p.m. more or less. For this one, we are going to tell you very specifically, please take this at 9:15 p.m. Please take this at 10 p.m., at midnight, whatever it may be, because we're timing the retrieval off of it 2 days later. For the egg retrieval, this is a procedure. You are going to be asleep for this. So what will happen is nothing to eat or drink after midnight the night before, no coffee, tea, or water on your way in. When you get here, you will get fitted with a beautiful designer gown, matching hat and booties, an IV for the best cocktails you've ever had before noon. And once you are comfortable, we'll put you to sleep and then go in with a vaginal ultrasound that has a special needle on the end. Pick up as many of those eggs as we can get. Afterwards, you'll come out to our recovery room. That is a day of no work, of no major decisions, of no driving, and nothing important that day. Really, the most relevant thing is probably no unattended online shopping while you are post anesthesia. And then after that, you're done. Now, we do want to make sure that no drinking, no sex, no gym, nothing like that for the month that you are going through this, from the time that you start your medications until the period that you get after the retrieval. The reason for this is that your ovaries, they're normally your ovaries, but they grow and they get to be much bigger. So they go from small limes to big grapefruits. And that takes up a lot of real estate in your belly. And we don't want them to twist and we don't want them to bleed. So hence the instructions, no gym, no sex, no bouncing around in any way. Looking at potential risks of all of this. So there's the medication component of it. These medications are injections that you're taking every day. They raise your hormone levels. Now, anytime your hormone levels go high, whether that is from medication or from pregnancy, which is the main time in most women's life that they have these high hormone levels, there's the risk of blood clot and stroke are the scary ones. Now, this happens less than 1% of the time, but it's possible. So we talk about it. Then there's the more common things of nausea, breast tenderness, feeling hormonal, mood swings, those types of things. What most egg donors do feel is bloating. And this isn't pain so much as just discomfort. It kind of feels like you've had 3 huge meals back to back to back, and you haven't gone to the bathroom yet, and you just feel full. And so it's not, like I said, it's not pain, it's much more discomfort, but it is uncomfortable. That will tend to clear once you've gone through the retrieval and have had a little time pass. It's also part of the reason why no bouncing around, no gym, nothing like that. Once you go through the retrieval, or as you start to get ready for the retrieval, the risks of any procedure are going to be bleeding, infection, and damage to other organs in the area. Now, this is less than 1%, but again, it's always possible, so we talk about it. All right, so those are the risks of going through this. Now, the last part of this is about being anonymous versus not. So this is, again, going to vary on what type of donation you've talked about. The vast majority of donations at this point are going to have some sort of disclosed identity. The reason for that is because nobody's anonymous anymore. And if you think about it, between Facebook, Instagram, all the other forms of social media, internet searching, facial recognition software, things like 23andMe or Ancestry.com, it doesn't take very much to make a connection between someone who donated her eggs at some point and a potential child. Now, with this, there's a couple things. I always tell donors, if you decide to have children or small people of your own at some point, make sure that you tell them that you were an egg donor. So that way, if they do 23andMe down the line, they're not surprised by what they might find. Even if you never do 23andMe, if anyone in your family has, that can have implications as well, because they can still figure out that it was you who was the donor. Most of the time, kids just want to know what their medical history is. If you think about it, you between the ages of 20 and 30 probably don't have much of a medical history, and there's a good chance your family doesn't have one either. 20 years from now, when a donor conceived child becomes of age, there's a much higher likelihood that you will have had something medical happen either to you or your family, whether that's high blood pressure, diabetes, a cancer diagnosis, things like that. And so in general, the main reason for any kind of connection is for them to know that information later. All right. So that's something that we always talk about. Make sure if you, when you're doing a donation, if you have little people in your life later, that you let them know what you have done when it's age appropriate for them to know. Now, I hope that your visit goes beautifully smoothly today and that you get all of your questions answered. Please, please, please let us know if there's something you don't understand, if you want to know more of. We are more than happy to answer these questions, and it's very important to us that you are comfortable and knowledgeable going through this process. All right, have a wonderful rest of your day, and we are looking forward to working with you.